Hi, everyone. I am Dr. Sheila Segerson, Director of Shelter Solutions at Maddie's Fund and a board certified veterinary behaviorist. Welcome to Maddie's Monthly Behavior Connection, a monthly webcast where we learn about topics of interest to those of us who are interested in animal behavior, providing support to keep pets in homes or supporting pets while in shelter or foster care. Our guest today is Dr. Valarie Tynes. Dr. Tynes is a native Texan and received her veterinary degree from Texas A&M University. She worked in private practice for 14 years before beginning her residency in clinical animal behavior at the University of California, Davis in 2000. Dr. Tynes was finishing up her residency as I started mine at UC Davis, so we overlapped by a year, I think. And I've been very lucky to learn from her and so happy to have her here today. Dr. Tynes has been a diplomat of the American College of Veterinary Behaviorists since 2003 and is also board certified in animal welfare. Her special interests are the behavior and welfare of pet pigs, exotic pets, and zoo animals. So I'm always reaching out to her with my questions on those topics. She has been actively involved in the Fear Free initiative since its inception and serves on the Fear Free Speakers Bureau. She's a frequent speaker at veterinary meetings around the world and author of numerous articles and textbook chapters. She currently serves as the shelter veterinary behaviorist for the SPCA of Texas in Dallas. Today, Dr. Tynes will be talking to us about managing separation anxiety in shelter dogs. Welcome, Dr. Tynes.
Well, as you said, Dr. Segerson, I'm going to talk about separation anxiety. I realized that this title could be a little misleading to some people. I'm going to say right up front, I am not talking about managing separation anxiety in dogs living in the shelter, because that is actually one of our big problems, is how difficult it is to diagnose these dogs before they go home with someone. But because I've been here at this shelter now a couple of years, this has become a problem that is of even greater interest to me than it was before, because of that feeling that I'm seeing a lot of shelter dogs go home with people and begin to display signs of separation anxiety after they've been in a new home for a while. It's also rather distressing that so many of our relinquishments that we get are of dogs where, when people fill out our intake forms, they check off behaviors that they've seen, and many of them are also very consistent with the behaviors associated with separation anxiety. And I get the feeling that these people had no idea. Not only did they not recognize a behavioral disorder in their pet, but because of that, most of the time they never sought any help for their pet, and they just end up in the shelter, sadly. So what exactly is separation anxiety? I guess the main thing I really like to get across to people is that this is a behavioral health disorder, or a mental health disorder, if you want to call it that. This is not something that is going to go away because we put a dog in just the right home, or people give it enough exercise or give it rules. I mean, these are all just some of the misconceptions I hear. This is a mental health disorder that has to be treated as such. And it causes an extraordinary amount of suffering to both the animal experiencing it, but also often the pet owner. And we'll get to that in a minute. There's often a question about whether or not separation anxiety exists in cats. I'm going to say that I'm remaining open-minded about it, but I have yet to ever diagnose separation anxiety in a cat. So it's not something I really talk a lot about, because I don't think it's very common, even if it does occur at all. But again, separation anxiety is literally either a fear, anxiety, or phobia associated with being left alone in a variety of different contexts, which we will talk about. But the other concern is that this condition is very common. We know it's common in the dog population. There have been studies that suggest as many as 20% of the canine population may be affected with separation anxiety. And we absolutely know, based on behaviorist reports, that it can make up anywhere from 20 to 40% of a veterinary behaviorist caseload. So it's very common. The fact that 2 of the first 3 medications that were developed and approved for use in a behavioral problem in dogs was for the treatment of separation anxiety. That should give you an idea that this is something we have long recognized as a problem. I had no idea that I might be seeing so many in the shelter, though, until I got here. So one of the things to keep in mind is that there is some different terminology used when talking about separation anxiety, some different, you can call them forms or subtypes. And I'm just going to throw those out here because I don't want to get hung up in what we call this problem. I want to concentrate on the fact that it is a serious problem that people have to deal with. So be aware that there are some dogs that seem to be okay as long as some person is present. Some people want to call those, isolation distress. Fine. Like I said, it's not really important to me. These are dogs that are okay, even if maybe their favorite person is gone. They might be a little stressed at first, but as long as they know someone's in the house with them, they are usually okay. I have actually seen for the first time a few cases of dogs whose separation anxiety seems to be moderated by the presence of another dog. And I want to say that with great caution because it's terribly common for people out there to go get another dog for a dog with separation anxiety, thinking it will help them and not realizing, or I guess even thinking about what may happen if it doesn't solve the problem. Now they just have, another dog to deal with. I think it's very uncommon that the presence of another dog will solve this problem. But I have to admit that since being in the shelter and having seen 1 or 2, I actually think it's a really great way to encourage fostering. So I tell people, if you think you might want another dog, but you're really wanting it to help your dog, just foster one and let's see if it really helps. And then you can decide if you really want it to be a permanent situation or not. There are dogs that are more difficult because they are, as opposed to the first category, dogs that are okay only if they have this one particular person present to whom they are very attached. And those can certainly be very, very severe because these dogs aren't relaxing with another person present. They're still too upset because the person they're obviously attached to is not there. And then there's what we call confinement distress, which again can look very similar, but I do think it's important we recognize this one as a separate diagnosis because it's going to affect to some degree how you manage or treat the condition. And we'll talk in more detail about that in a moment. But these are dogs that show the same sort of distress that we expect to see in separation anxiety, but only if they are confined. And again, these are dogs that people think, oh, I can't let this dog loose because it's going to tear up things. But they discover if they do leave the dog loose, sometimes these dogs are better. It was actually the confinement that was distressing to them. And some people will refer to that as barrier frustration. It's a dog that just can't cope with being confined in a crate or pen of any kind. Interestingly, those dogs don't really necessarily show up here in the shelter. So that's another thing that we can dive into in a little bit. So I don't believe that you can recognize a dog with separation anxiety because it acts distressed in the shelter, because personally, I think the majority of dogs confined to runs are distressed about being in runs, but when they go home, they're okay in a home where they don't have to be confined. So that makes it kind of complicated. Like I suggested in the beginning, a lot of people want to put tags on these, say, oh, that dog's spoiled, that dog's not getting enough exercise, whatever. Some people think that dogs with separation anxiety develop it if they've been at home with their owner a lot for a long time, and then they have a big change in their schedule, maybe where they return to work. And COVID has given us sort of an example of this concern. I don't know how many of you heard it, but during COVID, I felt like every week I was asked by someone about separation anxiety. Do you think we're going to see all this separation anxiety when people go back to work? And I would just say, again, be cautious about assuming that's what happens, because this is not a condition that you see if you're home with the dog. So by definition, you're not going to know your dog has it until you go. And yeah, I guess if you've never, ever left your home at all, you might not know that your dog is going to develop separation anxiety. But again, it's so complicated. We don't know. We truly don't know why some dogs experience separation anxiety and why some don't. Studies trying to find those, trying to identify those factors have really not given us anything extremely consistent between, studies. We see a variety of different factors sometimes involved. So it's really hard to say what causes it. But again, you cannot reiterate enough that what it is not is it's not because a dog is angry or being spiteful or vengeful. And really, really important, it is not solved by craving the dog. And we're going to talk about this more as we go on. But if you leave here with remembering nothing else, please remember this, that the first thing you tell somebody who reports that their dog is destroying things in the house should not be go get a crate. Because that unfortunately is a very common response. I hear it all the time. I heard it here from my behavior team before we were able to do some more training. But this is really, in my opinion, outright cruel to take a dog that is either escaping from a crate because it's distressed or is distressed in the home and is tearing things up. And so now we're going to just lock it in a crate that's harder to get out. I have seen dogs with all of their canines broken off. Of course, you've probably all seen some dogs with paws sliced up, toenails torn off, because they're trying to get out of a crate. And the part of the problem is that if a dog is distressed in a crate to begin with, and even more importantly, if they get the experience of tearing out of a crate, then the next time you put them in the crate, they are just going to keep trying harder and harder. So again, doing this is going to make the dog worse and may potentially lead to serious physical trauma to the dog, absolutely mental trauma. So what does separation look like? How do we really recognize it? And this is why it is something that you're only going to be able to diagnose after this dog goes home with someone. But this picture kind of gives you an example of what I think most people expect when they hear the word separation anxiety. And that is just a lot of destruction. Although many people understand too that severe separation anxiety can also involve the dog eliminating in the house while it's alone. It can involve the dog barking excessively while alone, whining, crying, howling. And if you think about it, the vocalization is the type of thing that unless you live in an apartment and you have neighbors who may report it to you or complain about your dog, you may never know that your dog is vocalizing while it's alone. So just as frequently, separation anxiety looks a little like this. And it is a dog that is starting to show its distress because it's alone, or because it's seeing its owner prepare to leave it alone. And this is when the anxiety begins for a lot of these dogs, when they see their owner preparing to leave. And it may simply be pacing, panting, maybe excessive salivating, maybe some whining. But a lot of people will think, oh, that's sad, but that's not too big a deal. The concern that motivates me so much to try to help these dogs is the fact that this is what mild separation anxiety looks like. And when you experience this sort of anxiety over and over and over, it is in the nature of these dogs for that anxiety to get worse. Okay, so they don't get better by just getting used to being left alone at home. If that happened, they wouldn't be showing this behavior, this distress. This distress is telling you that this dog does not know how to cope with being alone. And it is not going to learn as long as it continues to experience this terrible distress every time it's left alone. So another concern I have about separation anxiety that we see are dogs that are crated and people never realize they have separation anxiety because all the dog does is bark and whine and yawn like this dog is doing. Now, in this video, you are going to see this dog break out of this crate. But again, I ask you to think about the fact that if the dog never gets out of the crate, if it just lays there barking, whining, crying, it's feeling miserable. Okay, it's having a distressing experience. And if it continues to have that experience, because obviously most people have to go to work, they have to leave their homes sometimes. If they continue to have that experience in the crate, then what happens is the dog gets worse and worse and worse until one day you do come home to things like this. And again, this is what people often think about when we talk about separation anxiety. And they don't, they don't realize that before you see this dog has probably been suffering from separation anxiety for a very, very long time. We can't know how long, is it weeks, is it months, is it years? I don't know. But this is what I consider very extreme separation anxiety. And it starts mild in most cases, probably. So we need to be more proactive when dealing with these. And unfortunately, what that requires is a whole lot of education because there's so many pet owners out there that, again, have no idea. But for those of you who are taking in dogs in a shelter or, you do some post-adoption support with people, it's very helpful to keep in mind what some of the red flags are that suggest a dog may have separation anxiety. One of them is if the dog is what people call a Velcro dog, and you've hopefully heard that term. But the Velcro dog is just the dog that cannot be without you in the home, like has to follow you everywhere and be always by your side. Some of these dogs are at the point where if you close the door between you and them in the home, they will panic and they will start to tear at the door, or at least vocalize. But you do want to remember, again, this is just a red flag. Studies have shown that not all dogs that have separation anxiety are also Velcro dogs. And more importantly, a lot of Velcro dogs do not also have separation anxiety. So the two don't have to go hand in hand, but they can be. It is worth looking into if someone complains of that. Although most people don't complain of that, they complain of the other things like the crate destruction or escape. But when people tell me, and sadly, that they have a dog that they can't crate because it continues to destroy crates, or that regularly escapes the yard and they can't keep it in the yard, I look at that as a red flag, and that says I want to investigate and determine if this dog truly has separation anxiety. Dogs that don't eat when they're alone, this is another one that sometimes we have to kind of pick out of people in when collecting a history. But if you start out by telling people, as I often do, one of the first things you want to do to help the dog learn to be comfortable in a crate is be sure that you always give them something wonderful, stuffed Kong, whatever kind of treats you want to give, but give them something to help them think of that crate as a wonderful place. And then people will say, oh, I've tried that and they never eat it. I come home and it's still sitting there. That is a big red flag that the dog is anxious. Again, across the board, one of the things dogs will often not do if they're very anxious or frightened is eat anything. But if they're not eating something that's a special treat that's very high value that they only get when they're alone, that suggests that this dog is anxious when it's alone. Dogs that greet people when they come home in a very overly excited, very almost frantic manner are often dogs that have separation anxiety. Again, this is one that's been shown in some studies, but in other studies, it's not necessarily going to make the diagnosis for you. So again, it's worth asking about because it can be a red flag, but you're going to need other information to make that diagnosis. It's just worth looking into. And I feel the same thing about the history of destruction of any bedding provided. So people that tell me that they can't put any bedding in their dog's crate because they destroy it, that will make me start looking for other signs of separation anxiety. Unless it's a puppy and it's just tearing up things because that's what puppies like to do when they don't have anything else to do, I look for this as a possible sign of separation anxiety. Now, some of the other challenges that we face when trying to confirm a diagnosis of separation anxiety is that we have what I call, the great pretenders, if you will. And these are other behavior conditions or problems that can result in vocalization and destruction and maybe even elimination in the house, but that aren't necessarily separation anxiety. One of them are noise phobias. Now, we do have research that tells us that dogs that have noise phobia appear to be at higher risk of separation anxiety and vice versa. Dogs that have separation anxiety appear to be at a higher risk of also having noise phobias. But what we see often is that, let's say a dog has a fear, anxiety about thunderstorms or has a fear, anxiety of fireworks. And you're always home when those things happen, or mostly home when those things happen. The dog may be a little anxious. He may notice a little discomfort, a little panting or pacing and think, oh, no big deal. But those dogs, when left alone, often experience their anxiety to a greater degree because now they don't have someone home that probably gives them comfort. And so people who maybe didn't think their noise phobia was a problem for their dog will come home to some new destruction or elimination. Again, basically the dog's anxiety was higher because they are alone. So again, we have to be able to pick those things apart, and I'll tell you how in just a minute. The other problem we see with a lot of dogs is that they become very excited, aroused, vocal, whatever, about any outdoor stimuli. So you see the dog here barking at the window. So dogs that do this when their owner is home, it is very possible in some cases that the owner, calls them off, or, they go and they pull them away. They do something to make the dog stop. But if left alone at home, people that, pass by or people walking their dogs by may lead dogs to, again, get aroused and excited, and they will go to doors and go to windows, and they will do the same sort of destruction focused at doors and windows that a dog with separation anxiety might perform. So come home and it may look like separation anxiety, but it's not if it's only happening because the dog is excited about something going on outside. And one of the ways these can be picked apart is oftentimes These are the dogs where people say, he doesn't do it every day. Maybe once or twice a week they come home to this destruction, but not every day. It might be because there's something outside. It's the same thing with noise phobias. It could be a noise. It could be something that is getting them upset that day, but that doesn't occur every single day. I mentioned confinement anxiety earlier, again, isolation distress, whatever you want to call it. Again, it's important to try to recognize if the dog is just distressed about being confined to a crate or a pen, and if it might be okay when it's not in a crate or a pen. So you need to try to differentiate those things when we can. And of course, there's always the possibility for normal exploratory behavior. If you want to call it boredom, fine. But dogs, especially young dogs that have come from the shelter, and I suspect, as is the case with many of ours, that they haven't lived in a home, if ever, or for at least not for very long, they may really not know how to be confined in a home. It may be that is they've never been taught what to chew on and what not to chew on. And so they may just be going about exploring because there's all these things to explore, and dogs explore with their mouth. So just an untrained, bored dog can also be the issue here. And people, again, will need to look at how often it happens, when it happens, where it happens, and that's how we will make the diagnosis. The reality is, if you're going to diagnose separation anxiety or confinement anxiety, or differentiate these things I've been talking about, they absolutely must video the dog when it is alone. And even in today's day, where I think everybody is carrying a camera around in their pocket, right, and a video, because every phone has one, it is amazing how hard it is to get people to do this. Sadly, because it's not hard at all. And again, it is the only way, in my opinion, you can make this diagnosis. And some of the things you're looking at is, again, does it show anxiety immediately, the minute somebody is gone? And how long does it last? If you could get enough video, it's a good idea to get a feeling for how long it lasts, but also how severe is it? Again, I have video of dogs that immediately begin panicking and digging at a door and barking and carrying on the second somebody leaves them. And those dogs are usually pretty clearly anxious. But getting people to, again, think about how to do this, and it's not a big deal. I've even gone so far as to set up this in my home to show, see, up in the right-hand corner, there's the camera, and I've propped it up against something. And this is the door we leave from. So if the dog were to be exhibiting separation anxiety, you would at least see some behavior here initially. And if all you got were 5 minutes of the behavior there, you could say, yes, this dog has separation anxiety by watching how it behaves. If it doesn't have separation anxiety and it just wanders off quietly, then you still don't have an answer to why it is doing whatever it's doing, destroying things or vocalizing. Then that will require some additional testing, if you will. But this is a super easy first attempt at getting some information about how this dog feels about being alone. And of course, if the dog is already crated, I tell them, and they're crating the dog routinely for whatever reason, then I say, well, get video of the dog in the crate so we can see what that looks like. And again, it's easy to get a camera on a dog that is staying in a crate. But this video shows you why this is so critical. So you can hear that they've got nice music going, which is lovely, trying to help this dog. But this whining, the tension in this dog's face, the frequent kind of almost yawning tells you that this dog is very anxious. And again, we can identify the anxiety. What we don't know is if it's just due to being confined or not. This is the same dog we saw break out of the crate earlier. So it takes more information to determine, is this just about confinement? And we did that by asking this owner to, again, in this case, he confined the dog to a bedroom, which was his best option, and set the video camera up. And again, just I tell people, do this for, do this for just a few minutes if that's all you can do, right? You don't have to go run an hour-long errand if you're worrying about the dog destroying your house. I would never ask anybody to do that. But all it took was a few seconds of video to really see that this dog is certainly distressed now, even though he's not in the crate. So what do? You determine that this dog has signs of separation anxiety. Again, I don't want to sound like I'm not, that I'm lacking in empathy, because I wouldn't want to come home and find my home destroyed either. And if it matters to you, for what it's worth, I took home a foster dog once that did several $100s worth of damage to a room in just a few minutes. So I recognize people's need to protect their things. But we also have to think about the fact that if they must confine this dog, if we can't medicate it to the point where it is able to relax, then we're not going to make headway with it. And one of the tips that I tell people that may help is because, again, this dog has developed some anxiety often about the place that it was, the crate or the pen or wherever it was being confined. One of the things I urge people to try right off the bat while we're waiting for medication to work is to try confining the dog somewhere different, somewhere that it hasn't been confined to before. And you can see by the fact that this dog is wearing a leash that this isn't just a test run. So, because obviously if you were really going to leave a dog like this, I would say you don't want to leave the leash on. You don't want to leave electric cords hanging where the dog can get to it. But I encourage people to look for some place they can try leaving the dog that they can pet proof. And if the dog feels even somewhat better in that location, if the dog is not destroying things, if the dog is not eliminating or vocalizing, then we have taken a step towards treating the dog. So this dog you saw was just, circling, pacing. This dog is anxious. There is no doubt about that. But it's not as anxious as it was in the other locations that it was confined. And that's what's important. So again, we're trying to help keep this dog's condition from worsening. We're trying to keep it from hurting itself. And yes, we are trying to keep it from doing any more damage in the home, or at least not damage that is very, very expensive. The next thing you must tell people, and again, this is where education is so important, is just get people to understand that coming home and punishing these dogs or being mad at these dogs is going to make them worse. It is absolutely not going to help. For dogs that have anxiety about being alone, imagine how distressing and confusing it must be if now they have to worry that every time somebody comes home, something bad is going to happen. I mean, that would really put a dog in a state, because, yeah, it's like I'm upset when I'm alone, and now I have to worry about people coming home and yelling at me. So getting people to stop punishment is super critical. The big challenge that we have to really emphasize to people, and this, again, can be hard, is that medications are almost always needed to help these dogs. To varying degrees, we must stop the anxiety in order for these dogs to ever learn that it is okay to be alone. If, you tell people, well, okay, your other solution is to stay home with your dog all the time. And I have had our foster team, again, trying to put these dogs out and looking for homes where people are home most of the time. I don't care if you're home most of the time. I mean, think about it. Would it matter to you if you were only anxious and distressed for an hour a day as opposed to 8 hours a day? Both are pretty horrible. Or, once a week instead of 5 days a week. They're still experiencing distress when they're alone. And that distress will still worsen if we don't do something to stop it, to intervene. So medications are really important. And just for convenience sake, I separate drugs into these two categories of event medications, or what I call daily use medications. And event medications are most important to us in separation anxiety because these are the fast-acting drugs. They're things that you don't have to give every day, twice a day, in order for them to work. And sometimes it does help people to be told that you only have to give this to your dog when you're going to leave it alone at home. So for those people that are working from home part of the time, but need to be able to leave their home, event medications may be all that dog ever needs. And depending on the drug that's chosen, you can treat these dogs. Typically, I'm using trazodone and or gabapentin in some combination, and those do need to be given about an hour and a half to 2 hours prior to leaving the dog. And that can be hard for people if you think about it from a practical perspective. If you have to be at work at 8 a.m., but you have to leave your house at 7, can you get up at 5? Do you want to get up at 5 to medicate your dog? So we do have to keep that in mind. But these are the drugs that should go home with any dog the minute you diagnose it with separation anxiety. Actually, if you suspect separation anxiety because it's harming itself, I will start them on medication while I'm waiting for video, just because I want to try and stop this animal from hurting itself while we're trying to find out exactly what's going on. But the drug families that fall under this category, they're, like I said, it's the trazodone, gabapentin, the benzodiazepines like clonazepam, lorazepam. Those are the things that I typically reach for. Clonidine and propranolol used by some people. So I'm not going to get into that detail. I'm always happy to answer veterinarians' questions about these drugs, and I have dose charts I can share, that sort of thing. But the first thing I want everybody to understand is how important it is that you start with an event medication. Because the other medications, what we call the daily use medications, these are the ones that have to be given every single day. And they often do not really show any improvement until the dogs have been on them for anywhere from 4 to 6 weeks. And so this is another one of those situations. I have seen dogs experiencing severe separation anxiety distress, and somebody will just start them on fluoxetine. And that is really not ideal. The dog may ultimately need fluoxetine, but if that dog is harming itself, or if that dog is extremely distressed, you are basically sending it home and saying, here, you'll feel better maybe in 4 to 6 weeks. And that's not fair to the dog. So again, when the dogs are severely affected, I really want to start them on event medications first. And the other thing you want to remember about medicating these is that these drugs all have a dosage range, a published dosage range. So you don't just give a dog, trazodone and then leave it and discover it didn't work and say, oh, trazodone doesn't work, because that's not true. You increase the trazodone. And for many of these animals, it will require multiple trials of leaving the dog alone with one dose, get some video, see how it looks. If it's not better, then the next time you can do a trial, you leave it alone with this higher dose. So managing these dogs can be very challenging. There's no question, because you never know. I have had dogs go home and be great on trazodone and nothing else. And I have other dogs with separation anxiety that are on 4 different medications just so their owner can leave the house for an hour. And whether or not it's appropriate to adopt those dogs to people is a whole nother discussion that we could have at some time if you want it. But that's the challenge. Again, if we don't know if these dogs have this problem before sending them home, that means that whoever adopts them is either going to say, oh, I can't handle this, and return that dog. And if you're not careful, you won't get the information you need to really know what the problem is and how severely the dog is affected. Or they'll get attached to the dog and then they'll want to get treatment. And it's just heartbreaking when a dog requires, 3 or 4 different medications, or requires 6 weeks or 3 months in order for us to get it under control. That's very stressful for people. It's stressful for the dog, and I hate doing that to them. But you can't predict which dogs are going to respond really which way and what drugs. Because I know there are probably some non-veterinarians in the audience here. I did want to at least mention nutraceuticals. And I'll also include pheromones in this discussion. I know that some smaller shelters don't even have full-time veterinarians. So I understand that that may put you in a bind trying to help fosters with, separation anxiety animals, or adopters. Adopters, at that point, you may need to say, you need to go see a veterinary behaviorist. And if they don't want to, well, then their choice is to return the dog. But if you don't have the choices of sending them out with medication right away, do at least be aware that there are some nutraceuticals that have some evidence for decreasing anxiety in dogs. And the 2 that are probably we have the best evidence for are the alpha-casozepine and the L-theanine. Alpha-casozepine is most, it's found in a product called Zilkine that Vetoquinol makes, but also some of the calming diets, like the Royal Canin calming diet. I think maybe one of Phil's multi-cat diets may have a form of this in it. But this is it's a type of milk protein that's been shown to help decrease anxiety. And L-theanine is it's an amino acid. It's actually the amino acid found in green tea. Is what is believed to give green tea its calming properties. And it's available in a variety of different products now. The Ancetane that Virbac makes is one of them. And I think Soloquin by Nutramax has L-theanine in it. So just be aware that you could start dogs on these, and in a milder case, they might get better with that. It might be enough. And the same thing with pheromones. If there's good research that shows Adaptil can help decrease signs of separation anxiety. But even in that study that looked at separation anxiety in dogs, it took several weeks. They started getting better right away, but it was several weeks before there was significant improvement. So your challenge, regardless of how you choose to treat these dogs, the most important thing that can be done is the follow-up. And again, I understand that's not always easy in the shelter environment. It depends on your resources. But what's important is that we educate people to understand that you can't just go home and give it to the dog and say, okay, everything's going to be better now. You have to also get video to see, because again, this dog may have been eliminating in the house before and tearing up the blinds and shredding furniture. I don't know, actually. But now she's not doing any of those things, but she's still pretty anxious. She's whining and crying and pacing. And I have a theory that this is why some people start dogs on fluoxetine or Reconcile and say at first, oh, I think they did better, but now all of a sudden, a few months later, it's not working anymore. And I suspect what happened was, yeah, maybe the dog was better, but its anxiety was not completely relieved. And because it was not, the dog's anxiety just continued to build until eventually, fluoxetine was not enough to control it because it was so severe. So to sort of summarizing again, what I'd like you to take home are the fact that this is very profound distress that these dogs are experiencing. And it is not something that we should let people ignore if we can help it. Again, we can't make people do anything, but we want it to be very, very clear from the outset. If they're seeing signs of separation anxiety, this is not something that you can just ignore and hope it will go away, because the dog is going to suffer and it will probably get worse. Again, the early minor signs may possibly go unnoticed by most owners, or they won't think it's a problem. So when I talk to only veterinary audiences, one of the things I make a big deal about is in practice, you really should be asking certain behavior questions at every visit, at least once a year. Should be asking a few questions about the dog's behavior, because if you can be proactive and identify this, I believe you'll have a lot better chance at success than if you don't find out about it until the dog is tearing doors down, eating through drywall, and breaking its teeth off. Okay. No other way to diagnose it for certain than video. And yeah, we can treat it, attempt to treat it, because we think the dog has separation anxiety. But again, how do you know if it's getting better if you're not getting some video? You don't know. And we want people to understand that just because the dog is no longer tearing up your house or eliminating in the house or vocalizing excessively does not mean its separation anxiety is gone. Okay. And as I said, they don't get better on their own. They typically get worse. And the truth is, if you don't at least use some anxiolytic drugs, it's very, very difficult to get this condition under control. There are people out there that just do desensitization to departures for dogs with separation anxiety. And some of them are very skilled and some of them get improvement. But again, the thing people need to understand is you can spend 15 minutes a day training the dog to cope with departures, or training your dog to do anything for that matter. But if throughout the day, the dog can exhibit whatever unwanted behavior is bothering you, or can experience whatever fear, anxiety is experiencing, then you are literally taking one step forward and 2 steps back every day. And obviously you will never get to where you're going. So even if people want to work on desensitization to departures, these dogs need to be medicated for when the owner leaves. Because I have known of people who have been working for months and months and months with a trainer to help them with desensitization. And maybe, 3 to 6 months later, they can actually leave their house for 15 minutes. Again, that becomes a real quality of life issue for pet owners. And when a pet owner tells me that they have not been able to go anywhere as a family together for a year because of the dog that they have, I'm going to feel sympathy. I think we should all feel some sympathy for both them and the dog. So with that, I will get off my soapbox and take any questions that you have. And I added my email address here too, in case if anybody wants, I'm always happy to consult with other veterinarians, shelter management, behaviorists about these cases if you would like some assistance.
Wonderful. Thank you so very much, Dr. Tynes. This was an amazing presentation, and thank you for remembering to stop sharing your screen. We have lots of great questions, so let's jump right in.
Right.
The first one is, what does okay look like to you? In other words, what is an acceptable level of stress and correlated body language that an animal can tolerate?
Yeah, I think that's a really good question. And so one of the things I look at is not so much just what it's doing, but how long it's doing it. So I have had cases of these dogs where they're whining and they're barking, they're howling for an hour, and then they relax and sleep the rest of the day. And again, that's not good enough to me. I personally think anything more than about 5 minutes worth of anxiety it's too much. So if they're not, I would like to see them eat their treat, because I think they should all have a treat. And when they're through eating their treat, lay down and go to sleep, because that's what most normal dogs do when their owners leave them. And I will also say, though, I mean, we don't have the evidence to tell us, well, some dogs can, handle this much and they'll still get better eventually, versus no, if they're this little bit anxious and they continue being that little bit anxious, again, will it worsen in the coming weeks or months that they have to live with that? So any panting, pacing, salivating, unless it stops within like 5 minutes, I don't find that acceptable. And I'm would love to hear other people's opinions and experiences about that.
Thank you. And I would add to that it also sometimes relates to the level of anxiety that they're experiencing, because if they're panicking, I don't want 5 minutes of panic. So
that's true. Yeah. Yeah. So that's really what it boils down to.
Thank you. Great answer. Next question is, do you think that veterinarians in general are aware of how common separation anxiety is, or is there a resistance to recognizing it as a mental health issue requiring treatment?
Uh, I would suggest, and again, this is my opinion and based on my experience, that most veterinarians that don't want to even go there, they don't want to even talk about any kind of behavioral problem, because they feel so unprepared to answer the question. So they don't ask the questions because they don't know what to tell the person when they get the answers. Most veterinarians, I find, are really eager to put animals on medication. So I think that's why we still see lots of veterinarians handing out the medication, because they think the dog may have separation anxiety, but it's that they don't do the follow-up, or they don't have all of the information, that animal's not going to get treated as well, as thoroughly, as if somebody will take the time to work with it. And again, veterinarians in general practice nowadays, more than ever, they don't have 15 minutes to give somebody. So they often, like I said, I think they don't even want to get into those conversations. I hope that answered the question.
Thank you. Another question is related to veterinarians and medication, and this is a really common question, and that's that we have a confirmed diagnosis of separation anxiety. The owner is unwilling or unable to do behavior modification or make lifestyle changes. Do you prescribe medication? Do you not prescribe medication?
Oh. Yes, I am at the point in my career, and I admit I wasn't like this early on, but I've seen enough of these now that I do not hesitate to put these dogs on medication. I want to do anything and everything I can to relieve their anxiety, to help them feel better. And just because people don't want to, do some of the, like, let's say they want to keep crating the dog, I just tell them, well, these medications may not be enough if the dog is very, already distressed about the crate. Medication may not do it, but let's try, because anything's better than the dog living with that anxiety and distress.
Thank you. And tying into what you just talked about, you talked about this a little bit, but the question is, how would you keep a dog safe and contained if not using a crate?
Oh, well, it can be, a laundry room. It definitely is going to depend on the pet owner and the home they live in. And I admit sometimes there isn't an easy answer, but I encourage people to think about it, to try to think about it. And depending on the dog, an X pen might work. Obviously not for a great big dog, but whatever, room they pick, it just needs to be a place that's safe for the dog. And so as pet proofed as possible, and maybe the room where they are least likely to have a lot of valuable stuff destroyed. So yeah, that's a real challenging aspect for a lot of people.
Thank you. And I would just add to be creative. If the people can afford it, dog daycare. If people can't afford it, if there's a retired neighbor, sometimes retired
Yes.
neighbors who don't have animals would love to have a temporary dog that can visit during the day. So be creative when looking for solutions.
Yes.
All right, next question is, if you use event medication and have several positive experiences with it, so the dog is not destructive and not anxious, is there a chance that the dog will learn not to be anxious, or will the dog likely always need medication?
That is such a great question. And I'll tell you that is the theory that I work on, the theory that I function on, is if the dog could learn from repeated negative experiences that being alone is horrible, why wouldn't it be possible for us to help him feel better enough that after repeated experiences, he could learn that, oh, it's okay to be alone. Again, the challenge is, how long might that take? And I'm sure Sheila, it's, some people, they want the minute the dog is better, they want to take them off medication, right? Even if it's been a week or a month. And one of the things I will tell people when it comes to making that decision about trying to withdraw medicine is, I want the dog to have been perfect, if you will, or as perfect as you need it to be, for about 3 to 6 months, 6 months ideally, before you consider trying to wean it. And then that weaning needs to be done very, very carefully, preferably with the assistance of your behaviorist or your veterinarian, because you don't want to wean things off too fast. Let's say you have a dog that's been on medication for a couple of years. I'm going to wean them very, very slowly. And if you wean them too fast, then you may, see problems return, and it may be harder to get it under control the next time. But I tell people there's always the possibility. But it's amazing how many people, once they discover what it's like to live with a dog that's not panicking every time they leave, they will be afraid to take them off medication and just say, I'm just going to keep doing it. Like, that's fine.
Our next question is, are veterinarians, or does treatment include suggesting a well-rounded lifestyle, mental and physical enrichment, a structured and scheduled life before medicating?
Not if the animal's suffering. I mean, if we were doing a good job in general practice of thinking about mental health, those are the things you want to talk about the minute people get the dog, right? Because every dog deserves to have a safe, structured, comfortable lifestyle with plenty of enrichment. It's something we should be doing before they develop problems. Once a dog develops separation anxiety, you've got to stop that anxiety. And it is unlikely that there are many lifestyle changes that are going to give that dog quick relief. I'm not saying there are not some dogs out there that are bored to death and need enrichment. But again, separation anxiety is not the same thing as boredom. This is a mental condition, and the animal usually needs assistance. If you've made that diagnosis, for sure, the animal's usually going to need medication.
Thank you. And so that's why you spent so much time talking about the diagnosis, so we can differentiate true separation anxiety,
Exactly.
where an animal is suffering from that condition. And it's not that that dog wouldn't benefit from enrichment and all of those things, but when the anxiety
Right.
is that severe,
Yeah.
they need
Yeah.
medication. So thank you.
Yeah. And Yeah, and I use that issue again of whether dogs will eat or play with whatever you leave them with. That tells you as easy as anything. If that dog doesn't eat, if it doesn't engage with toys or treats or rides, then that tells you it's anxious. They can't, when they're anxious, they can't eat.
Thank you. Next question is, has there been any research on using CBD to combat separation anxiety?
I'm not sure that there has specifically been any on separation anxiety. So if you've seen it, share. But what I believe has been done is a little bit of research on just anxiety in general in dogs. And my impression was that it wasn't super impressive. Like, but there's just very limited good research on that right now.
Yeah, I found one study that I'm going to put a link in chat about I haven't read it yet, but about single use of CBD related to separation. I think it's just separation and not separation anxiety, but once again,
Okay.
I haven't read the article. And I also found a 2024 article about CBD assessing separation anxiety in cats. So those will
Oh,
be
yeah,
good
cool.
ones to take a look at.
Yeah,
All
thank
right.
you.
Next question. Would you diagnose separation anxiety if a dog only displays those behaviors when the departure is not predictable? For example, the dog
Mm.
is fine with routine absences, but if the family had to leave the house very suddenly without the usual cues, the dog would panic.
Again, if the dog's panicking, that's something for me to be concerned about, whether or not we want to call it separation anxiety. But there's no question that the issue of regular schedules versus irregular schedules are important to some dogs, because that's a pretty common complaint by some people, that the dog is okay until you do something out of the ordinary. And I would just suggest that that dog still has a problem, because again, a normal individual should be able to cope with an occasional change in their schedule, right? Um, it's no different than people. If you have to change your schedule and go to work from 2 to 5 instead of 1 to 4, that shouldn't be distressing to you. You should be able to cope with that. So I do find that some dogs that I'm treating that seem to be getting better and like be on a steady course of improvement and will be doing well, and then have a problem because of an unpredictable departure. So I would also suggest that, again, when people say the dog is okay when the departure is predictable, do we know that for sure? I would want to see that. I would honestly, I would say, show me. Show me the video, and then I'll believe you, and then we'll talk about it.
Thank you. Next question is, does treatment include lifestyle adjustments, which we already talked about, or accepting that the dog may not be the right fit for the people?
Well, I think that's, an important discussion for us in the shelter to get used to, that and comfortable with, that if the dog has severe separation anxiety and it's not able to be controlled with medication, that dog may not need to be a pet for anyone. But certainly, as an example, the most recent dog I had, where the lady told me after a while, she said she had not been able to go anywhere with her family for months and months because of this dog's separation anxiety. And they returned the dog, and it ended up going home with a single lady that did have a more predictable schedule and was home more. And at this time, knock on wood, we think that dog is doing okay. So this throws another monkey wrench in the works, and in my opinion here in the shelter, is that, again, they may come into intake with some of these red flags, but do you make a decision to euthanize that dog when you don't know? Do you make a decision to euthanize it if you know it has separation anxiety, but you're not yet sure if it's maybe one of the easier ones to treat? Do you take that risk of putting that dog in a family? And like I said, if some will get really, really, uh, in love with the dog, and then they will have to be jumping through all these hoops and going to all this trouble. So I don't think there's an easy answer there because I'm not sure we know that any home will be better than another for which dogs. That makes sense.
That makes a lot of sense, and I
Yeah.
really appreciate that answer. Thank you.
Uh,
Our last question is, do you recommend event medications for shelter dogs that are anxious in their kennels?
Well, if I understand what you're asking, for what it's worth, like that's what I medicate for in the shelter, are these dogs that appear to be anxious and distressed in the kennel.
Yes, so
Whether we
that's what
call
they're
it,
asking.
yeah, whether we call it kennel stress, kennel frustration, or anxiety or whatever. When I see a dog that's distressed about being kenneled, I am going to medicate it, and I'm going to try to get that under control with whatever I have at my disposal, because I don't think it's right for that dog to live in anxiety about being confined.
Thank you. That's the end of our questions. Thank you, Dr. Tynes. Thank you all so much, and we'll see you next time.
All right.
Bye.
Thank you. Bye-bye.